Right. So in the last session, we have discussed about the facets and what are the different fields which are available in facets, right? So that's what generally we have discussed.
Right.
Now, let's getting into the direct structure of 4 different rules, which normally we use as part of stakeholders, because being a business analyst, we should able in a position to coordinate between stakeholders. That is important, you know, right?
Right.
So as whenever we
Yes.
learn business analysis, there is a knowledge area which we discuss about. In that knowledge area, one thing we discuss about stakeholder engagement, isn't it?
Right. Yes.
So stakeholders, managing stakeholders and engaging the stakeholders is essentially important. That's what we have discussed.
Right.
These stakeholders of of many types, usually in the field of general application development of any IT or something, stakeholders may be of anyone, right? So they may be development team, it could be a business owner, it could be a project sponsor,
Right.
it could be a subject matter experts, it could be developers, testing team, architects, external people, right? So all these people are stakeholders.
Right.
But now when we are discussing healthcare, especially US healthcare system or healthcare system, when we talk about the major stakeholders, whatever we see, especially in healthcare domain, will be divided into 4 different parts. Let me do it on paint so that you can understand better. 1 minute. Yeah. See, normally there are 4 different roles we can see in healthcare. First of all, being a BA, we should know about what are those roles and what normally these people were. And people means that entity, particular entity is all about. And what is that they are going to do, right? That's what we are going to discuss in the first thing.
Right.
So normally stakeholders, will be as follows in context to healthcare system. Okay. As follows. Right. So this is what it was, stakeholders. Now, these stakeholders will be as follows. The first one is called policy makers. First one is called policy makers. Now, after policy makers, the next is called patients or beneficiaries, I can say, right? Or I can say beneficiaries.
Okay.
Right? Beneficiaries. Right? So patients or beneficiaries. The third one is called providers. Okay. The fourth one is called payers. Understood, Shalini? Okay. Right? So one is policy makers. Second, beneficiary. Rather than patient, it's better to say beneficiary. Beneficiary is the best word to use it in a proper thing.
Okay.
Means who is benefiting end of the day. Finally, some Y is a person has joined in a healthcare hospital, got treated, and against to the treatment which was made to him or her, there will be some reimbursement happens by the payers, right? So end of the day, beneficiary is a person who is getting medical treatment, right? So that's what. So patient and the beneficiary, I can say. Next is providers, at the same time payers. So these are the 4 people, 4 roles, I can say, 4 different stakeholders you see. Now, normally when we see the policy makers, when we talk about policy makers, means people who make policies. Because being a BA, we need to understand this in detail. That is important. The reason I'm explaining all this from the basics. Because most of the people say that claim processing, claim adjudication, right? HIPAA rules and regulations, EDA transactions. Okay, that's absolutely fine. That we have to learn in depth. It is required. But before we are getting into that, it is always important for us to know about the jargons and terminologies, what and how this is being used.
Right.
Okay. So policymakers, nothing but people who make policies, right? So either it could be an healthcare ministry, right? So Ministry of Health or someone, right? So whoever is making some policies and the government entities, I can say. In a simple note, I can say, because government entities or government this thing body will make some policies, right? So for whatever the policies, either when we talk about healthcare, it is relating to the healthcare related information, related all that stuff. Wherein generally these policymakers are the people who will be aggregating the data, whatever the data relating to the patients, relating to the providers, payers, right? So all these things, because whatever the metrics, because year on year, population will change, right? So because some people will add, right? Some people may demise, right? So different statistics. Every year they have to see the statistics of number of people who are available now, right? So age-wise, right? Gender-wise, right? So that calculation, that census, I can say, in a simple note, the census. This census will be maintained by generally the policymakers or a governing body, government body. So these government body are the people who makes policies. These are the people who make policies. These policies, as well as the facilities, what they are providing, will change from context to context. Maybe some slight variations they may be given, depends on the kind of situation, people were, etc., etc. Am I right?
Yes.
Right. Now, when anyone wants to make policies, for example, if X is a body who are making some policies, right? So policy makers and all, if we call it as. Normally, we need to understand these policy makers. When they are making some policies, they have to have some answers per few points, right? The questions as follows. The first one, being a policymaker, whoever is the policymaker and all. So policymakers should know about few things well in advance. The first one is that who is eligible. 1 minute. Just a second. Yeah. Right. So who are eligible to receive care? Right. This is point number one. Because if policymakers want to make some decisions and all, they must be knowing about people who are eligible to receive care. Next. Second point, what kind of care services provide. At the same time, we must be knowing about how, where, and to whom. Understood? Clear, Shalini? Right? This is the second point. Next, are the services are free of cost or paid? Are the services are free of cost or paid? Because depends on the kind of economical status people belongs to. Some services will be free of cost. Something will be paid. Am I right? Right?
Yes.
Now, are these accessible or not? Are these accessible or not? Because these must be accessible to the people whoever are really getting benefit out of it, right?
Right.
Understood?
Yeah.
Yeah. Next, being a policymaker, one should be able in a position to understand the healthcare concerns. I can say what healthcare. Healthcare concerns that they must consider in future, right? What are the healthcare concerns, right? So they must consider in future, right? Maybe because this is a continuous process, because as I said, because population will change, right? Population of the census will change.
Right.
Different healthcare services we need to provide. It depends on the situation we were in at that point in time. So different changes to be made by the policymakers by keeping the welfare of the health of the people, all that, right? So this is all something which generally the policymakers has to keep into an account. Understood, clear, Shalini, right?
Yes.
This is point number one. Now, next thing is about when we talk about beneficiaries. Beneficiaries, nothing but, as you know, people who are getting benefit out of it. Generally, these people are called patients or beneficiaries, because these people usually citizens, people of citizens and all everything. At the same time, people whoever is paying taxes, because whoever is paying taxes and all taxpayers, right? So all these people are comes under this category, whoever are, right? So people are nothing but beneficiaries, because every person will have a valid health insurance plan. So all these people are comes under patients. Okay, this is point number two. Now, third one is called providers, right? You know about providers. Providers, nothing but people who are providing the services, right? Whatever the care delivery uh, they are providing and all everything is called providers, nothing but hospitals, clinics, right? So nursing care and all. But end of the day, ensure that these providers should provide care delivery and all everything within the framework of the policy. That is where, as an example, even we have discussed earlier called HIPAA, Health Insurance Portability and Accountability Act. The reason we have discussed. Why? Because Health Insurance Portability and Accountability Act is a policy framework which was, of course, it's a law. It's a standard which was initiated by the government of US, wherein health information has to be protected. So whoever the providers and whoever is providing care delivery for the beneficiaries and all as the patients, whoever has come to them. But whatever the delivery services are they going to provide must be under the policy framework which was initiated by the policymakers, by the government, because there are some rules and regulations and all. So that people have to be followed, right? This is where generally we call it as regulatory board or regulatory authority. Right? In a simple more terms, we call it as regulatory authority, regulatory board. This regulatory board or regulatory authority is applicable for everything, not only for healthcare. I'm not pausing it. I'm just deviating from healthcare to an extent, slightly to have a wider understanding. Regulatory board or regulatory body, right? What was it? Regulatory board and regulatory bodies, nothing but their responsibility is to ensure whatever the standards, policies, and procedures as government has initiated, people has to follow it. There should not be any deviations should be taken place by the people who are doing their enterprises or business. So this is not only relating to healthcare. You can see this in finances, banking, finance, even insurance also. Okay, insurance need not be healthcare, right? Insurance can be anything, right? So insurance can be vehicle, insurance can be property, life and annuity, right? So etc. etc. Even banking, because banking have a lot of services portfolio related, right? So they provide loans to the people, right? They are eligible to take deposits, because collection of deposits are not authorized to take by everyone, because there is a body which that body has to accept it, right? So then only people will be taken, right? So people are eligible to take deposits and all that. whenever
Right.
they have taken deposits, to what extent these deposits has to be invested. For example, Y is a financial institution. Okay. Y is a financial institution. So this are a bank, whatever I can say, right? Y are a financial institution or a bank, are got a permission to gather deposits from the people. Right? They got the permission because not everyone are allowed to gather deposits. Only they should have a they should get some certification and they should be under the rules and regulations. So they are usually they have taken deposits. Right? Against to the deposits what they have taken, this is the money of the people which taken by the banks and financial institutions. So whenever customer wants, they have to pay back. This is the structure, right? That's what we do because we deposit money in the banks. Whenever we require, we will be taking either from different means. We can take the money. Now, in between, what these financial institutions and banks do, there will be two major things. Some countries, underline this point, some countries, against to the money what they have deposited, what customer has deposited, against to that, they'll be paying some interest by the banks to the customers. Maybe 1%, 2%, 3%, all that. Some countries. For example, if you take India as an example, against to the money what they have invested in finance in the bank or itself, they'll be charged some kind of service nominal percentage of per 1% or 2%, whatever it is, percentage will be paid, right? That's what interest they'll pay. But in some countries, Y is a person who is depositing money. Against to the deposit, what is he doing? Financial institutions or banks is protecting their money, right? For that, they charge service charges. There are two differences. Do you understand the difference, Shalini? Right?
Yes.
Right. So, for example, Y is a person who is depositing some money in his account in a bank or a financial institution. To manage his account, to manage his finances and all, bank will charge some service charges on it. That's how it is, right? Even in the context of here also, there will be some service charges they do, but at the same time, they pay some interest on it, right? That's the structure. It depends on the banking and financial structure of a respective country. It varies, right? So that is different. That's not the point. But whenever they have taken deposits or something, what they have to do, this has to be multiplied. This has to be added. So what banks and financial institutions do, this money will be given as a part of loans to different people. Am I right? Home loans, right? So either it could be personal loans, it could be of any other means. Generally, this money will be paid in a form of loan to the other people. Am I right? Yes, sir.
Yeah.
Right? They'll be paying.
Yes.
This money will be paid again. Whenever they are paying this money to other people, right? So whenever they are paying money to the other people, against to that, when someone is taken loan, on that they have to pay some this rate, right? So there will be some percentage of this thing, right? So which they have to pay through interest. So that money will be the profit to the bank, right? Next. So banks and financial institutions are authorized to transfer their fund to some stock market to an extent limited. They can invest in the stock market so that they can gain some more profit out of it, right? So they can do that, even that. So regulatory body, coming back to the regulatory body, what regulatory body? Regulatory body will have some rules and regulations which will be framed. So whoever is managing a financial institution, there will be some rules and regulations to do some business, right? Because they should not give any kind of false commitments to the people, right? So no malpractices are allowed, right? So if someone is doing it, right? What kind of action will be taken? Everything will be there. To control everything, there will be a regulatory body. Understood, Shani? Right? Either it could be healthcare, it could be of different names. It could be of different names, it could be of different procedures. But either it could be healthcare, it could be banking and financial services, it could be insurances. There will be a regulatory body These regulatory body will regulate the operations of a particular enterprise, of any enterprise, which is comes under that particular domain, right? In the same way,
Right.
again coming back to the healthcare, in the same way, whoever the providers is providing healthcare to the individuals as well as patients or beneficiaries or people. So whatever the services they are giving, it must be under the policy framework of the policy makers, which was initiated by them. Right? This is what we call it as providers. The third thing is called payers. We talk about payers. Payers nothing but the people who are paying. Right? So against to the enrollments and all that, whatever end of the day paying and all everything, all these people are comes under payers. Who is paying and all that, right? So this is what generally payers stands for. So these are the four different stakeholders which normally we have in the context of healthcare. One is policymakers who make policies. At the same time, patients are beneficiaries, providers, at the same time, payers. These are the four. So beneficiaries is a word I have used to make you understand much easier. On the context, I have used it. Okay, so these are four P's, I can say, right? Four P's, policy makers, patients, providers, and payers. So being a business analyst, now here is the point. Being a business analyst, why are we learning all this? For what reason? So business analysts are the people, fundamental role of a BA, as you know, to understand the business requirements and providing solutions. Am I right?
Right.
Now, what was meant by a business requirement? Business requirement need not be in terms of solution, but developing an application for a solution. It could be a policy, even someone is initiating. Am I right?
Right.
Because whatever the policy changes, some Z or Y wants to make, right? So some policy changes. What they have to see, they have to see the continuous changes, whichever is happening, and what are the changes to be made, what are the major and minor changes to be made into the existing ones, everything has to be taken care of by. Agree, right? So,
right.
If you are a business analyst, it's not only about understanding the business problem, providing the solutions, right? So further preparing documentations, writing user stories, etc., etc. Apart from that, that is one line. Second, about knowing about the claim processing, adjudication, how the claim processing will be taken place, right? So how we connect with payer to provider, right? So subscriber, right? So all these things are comes under the second one. The third, being a business analyst, we need to understand the framework of four P's, which is called policymakers. What they do. Why? Because if there is any kind of policy related changes to be made, again, I'm repeating this services, being a business analyst, we do not for every job. Not for every job. For example, there will be some jobs. Let me put you an example. For example, there are some jobs which we see business analysts working for Medicare. Business analysts working for Medicare. So Medicare and Medicaid is a organized by CMS, Ministry of Health, will be taken care of all it. So they require a business analyst who has to manage all this. So a person is working in a government entity. He is not working for a private organization. It's maybe Ministry of Health, they are working. Right? Ministry of Health, they are working as a business analyst. So being a Ministry of Health, what they are a policy makers. Right? Means there are some policies which they make according to the needs. They will make some policies. And if there is any kind of changes to be made in the existing policies, they are the people who are responsible and who are eligible to do that. Am I right? Right?
Right.
Now, there must be someone who should understand the business scenarios. This is where generally business analysts come into picture. That's the reason whenever we apply for jobs or whenever you see job portals in context to the role of a healthcare BA, it's not only with private insurances, even you can see some job opportunities which are connecting to Ministry of Health. Sometimes. Do you understand my point here?
Right.
Ministry of Health also. Why? Because they are the one who is managing the large scale of Medicare, medical claims and all everything in regular intervals. So they required some kind of business analyst, not only to manage this claim related things, but also if there is any kind of policy related changes we're making, so someone has to address these and someone has to do some needed modifications into this. So to provide some guidance and all of the generally being a business analyst, we will be useful, right? This is point number one. Next, being a business analyst, to what extent we are connecting to these patients or beneficiaries? Hardly nothing. Because being a BA, we are not getting into the second point. But for providers, there are some job opportunities you see. Business analysts they require for claim processing, maybe for a healthcare organization, some XYZ healthcare organization, right? Right. Now, means what it is, healthcare organization is nothing but a provider by itself. Whenever there is a treatment was given to the patients, they have to process these claims, right? They have to process the claims. So for that, they require some business analysts who should understand the requirements in this level, wherein they have to provide the needed services here. This is where generally business analysts are connecting to the providers on these grounds. Clear, Shall?
Yeah.
Next, payers, nothing but people who are paying. Again, government, not only government body, I can say Medicare and Medicaid, CMS and all everything, may be a payer also, because they are the one who is paying. Or else private insurance companies can also become payers here. Understood? So understanding over these four are essentially important being a business analyst whenever we are working on healthcare organization. Understood? Clear? Shall we?
Yeah. Yeah.
Any questions on this regard?
No.
Right? So these are the four. One is policymaker, second is payer, third is patient or a beneficiary, or else I can say called as provider. So managing all this, because if you see closely, there is an interconnect among these four people. Do you agree?
Yes.
These people are called as stakeholders. Agree?
I'm sorry, say that again.
These people are called as stakeholders. Agree?
Stakeholders, yes.
Right? So managing these stakeholders individually, between or among, is essentially important for whom? For a business analyst. Right? Am I right?
Right.
This is where internally, when we talk about stakeholders and all, this is where generally being a business analyst, whenever we are working in healthcare system, understanding and as well as the roles and responsibilities of a particular stakeholder is essentially required. How they do, what they do, and what process do they require to follow. Everything should be known to a BA. So for that, they should know about the stakeholders first. So these are the four different type of stakeholders which normally we see. Clear to you, right?
Yes.
Now, on a simple note, you can write down some points on a simple note. So what these four people do on a simple note, you can write down. If you want, otherwise you can take a screenshot.
Okay.
Now, policy makers are the people who takes care of context setting.
Okay.
Who takes care of context setting. That's what this policy making honest. This is point one. Right? Now, when we talk about the patient, right? Provisioning care to them is also happens, right? Next, provider means who provide care services, right? Care provision will be received by the patient, provider who provide care services. Next, payers are the people who takes care of the procurement. Understood? Clear, Sharon? Right?
Yes.
Right. So this is what generally being a BA you need to know, right? One is policymakers who will be involving in context setting all that. Patients who will be the care provisions people, provider, nothing but person who provides care services to the patients and all that. Next, at the same time, payer, nothing but persons who are doing this procurement organization.
Right.
Clear?
Yeah.
Yeah, sorry. Right. So these are, I think, I have added one name.
Yeah, I know. It's okay.
Okay, right, it's okay. So this is how generally the overall structure of the stakeholders, being a business analyst, we need to manage in real time. So how this internal, being a business analyst, how these stakeholders work one among all, right? So how they are going to interconnect and what is the structure flow? I can say that I don't say it's a flow diagram, but how this flow happens among these four people that I'm going to discuss tomorrow. So how this interconnect, how this policymakers are interconnecting with the payers, or maybe with providers, or maybe for patients, right? How this interconnect happens. Followed by this, we must be knowing about the kind of the kind of service, it's not services, the kind of activities which normally these people have to do, and how these people do from the point of different viewpoints, because viewpoints are different from one to another. Because viewpoints from the policymaker viewpoint is different. At the same time, payer viewpoint is different. Patient's viewpoint is different. Provider viewpoint is different. Because business analysts should understand the viewpoint from the different stakeholders, not from the single stakeholder. Agree, right? So policymaker viewpoint is different. At the same time, payer's viewpoint will be as separate, followed by this provider's viewpoint is different. At the same time, patient viewpoint will be different. So how this viewpoint works, being a business analyst, we should understand internally. That I'll be explaining about this in tomorrow session. Anything questions to you?
No.
Is it clear now to you?
Yes.
Right, so this is what it is. So yeah, we discuss about this remaining viewpoints related stuff for all these four people in tomorrow session. I'll show you this diagram. I'll create a diagram and I'll show you on paper so that you'll be understood.
Okay.
Right, Shani? See you.
Yes. Okay. Thank you.